So, welcome to the Black Archive Safer at Home virtual series. My name is Louis Berthen. I am the assistant archivist. And today we're going to be doing my segment, which is called Legacies, Profiles in Greatness. And we are going to continue with the theme. And today we're covering another woman. And her name is Jessie Mae Collins Trice. So here's a photo of her. All right. So she was born Jessie Mae Collins to Hattie and Herbert Collins on December 26, 1929 in Baxley, Georgia. She was the eldest of two, with her younger brother being named Herbert after her father. She spent her early years in Pahokee, Florida. She graduated from Everglades Vocational High School in Belle Glade. She started preparing for her profession in 1947 by entering the Grady Memorial Hospital School of Nursing in Atlanta, Georgia. So while she was at Grady, she met her husband, James Harold Trice. Together, they had two children, a son named Bradford, and like Trice, okay. Children's son named Bradford and a daughter named Valencia. After graduating, they relocated to Miami, and here, Jessie decided to continue her education. So she became the first Black woman to graduate from the University of Miami School of Nursing Baccalaureate program. And this was not all. She had also received her master's in public health administration from the University of Michigan in 1975. Now, before I get to her incredible career, I'm going to give you a story from 1964. So this was published by the Miami Herald on April 2nd, 1964. And this is how it starts. She'll retry home. Negro mother is optimistic. Mrs. Jessie Trice will move into her new home this Friday again. She moved in once 2 weeks ago, but had to leave 3 days later because her glass back door had been smashed and black paint smeared on the front of her house. I hope to have the back door fixed so that we can go back, said the 34-year-old Negro mother of two. Mrs. Trice, a registered nurse with the Dade County Health Department, brought an $11,300 home at 3360 Northwest 208th Terrace in Riverdale Estates last month. The home was one of the reconditioned Veterans Administration homes that had been foreclosed. I had been trying to find a suitable home for my children, Valencia and Bradford, and I saw the ad in the paper and went out to see the home and decided on it. I had not anticipated any problems. I did not think of the neighborhood as being white or Negro. I only intended to find a suitable home. She is separated from her husband. Reverend John F. Kiernan of Holy Redeemer Church, where Mrs. Trice's children attend school, heard about the paint and rock throwing incident and reported it to a meeting of civil rights and religious leaders. The Corps and the NAACP immediately announced investigations into the matter. Residents of Carroll City, which border Riverdale Estates, have registered angry protests against the VA sale of foreclosed home at reduced prices. They charged that indiscriminate sales would lower property values in the areas. You could see their concerns. I don't anticipate any more trouble, said Mrs. Trice. Maybe my coming was a shock, but people aren't really bad. I think it was just a rash act that won't be repeated. We'll just be there, and I don't see any reason why we won't enjoy it. And so the Miami News also published a story on this. This is from the same day. I'm going to just read some quotes. We intend to see that new security measures are instituted in the area, said Corps Vice Chairman Dr. John O. Brown. Along with other civil rights groups, we plan to make a survey of this neighborhood to find out the attitudes of residents about Negroes. Residents of Carroll City, which adjoin Riverdale subdivision where Mrs. Trice's home is located, protested a news story placing their house in the community. Nothing like that could ever happen in Carroll City, declared a woman resident. Dr. Brown said he understood Mrs. Trice will move back into the pink 3-bedroom home sometime this week. We don't anticipate any more trouble, he added. The FHA and the VA recently announced the resale of 150 foreclosed homes in the area. The vandalism was reported to a biracial forum here Monday night by Reverend John Kiernan, pastor of Holy Redeemer School and Church, attended by Mrs. Trice's children, Valencia and Bradford. Immediate investigations were asked by Dr. Brown and Dr. George A. Simpson, local NAACP vice chairman. So now we're going to move on to her career, but you can see that personally she was already dealing with, I guess, what we could call white fear, then the first round of white flight from the Carroll City and the Estates subdivision. So she had to deal with that personally, and I can't imagine, we're gonna move on to her career now. So in the 1970s, She was already gathering Black nurses and health professionals like herself. She organized and founded the Miami chapter of the National Black Nurses Association, and they would push a program that would encourage Black nurses' leadership and improving health status in the Black community. In 1975, she was also asked to be part of the Health Planning Council of South Florida, and they made sure that state funds were dispersed in a way that would actually help the Homestead and Florida City communities. So, as a health professional, her career is unmatched. She was the first Black woman to serve as a director of nursing for the Miami-Dade County Health Department, and she also served as the only Black woman to act as a chair of the Florida State Board of Nursing, and that was in 1979. She also served as the president of both the national and state associations of the community health centers. So with that, let me read to you from a 1970 paper. So this was the Miami News, September 7th, 1970. Miami nurse receives White House invite. Jessie Trice claims she's no expert when it comes to raising children, but apparently someone at the White House disagrees. In December, Mrs. Trice, senior supervisor of the 46th Street Health Unit of the Dade County Health Department, will meet with more than 4,000 delegates at the White House Conference on Children and Youth. The conference has been held once each decade since 1909. At that first meeting, such prominent figures as Jane Addams, Theodore Dreiser, Booker T. Washington met to discuss problems of orphaned and deprived children. Again this year, the concerned people from many fields will meet to study the wide scope of problems facing the 1970 child. Mrs. Trice, a specialist in pediatric nursing, will be a vice chairman of a forum, Emergence of Identity, which will study the child's conception of himself from birth until he enters school. And so just a quick side note. So Mrs. Trice has something that we would call a very holistic view of medicine. As we know, Western medicine really tends to focus on medicines and how the body is feeling. And she really does meet in the middle and makes, and we'll see this more with her work later on, but she really considers the body to be a healthy mind, healthy body sort of setup, right? And so we see this here. And how does a child develop a good image of me? A child must have a sense of security, that if he needs something, someone will be there to help him. He must have a feeling of trust and love, she said. And a little tender, loving care and understanding always helps, she said. A mother who spends time with her baby, plays with him, and talks to him will help him develop self-assurance, she said. Later, when the child is 2 or 3 years old, he is constantly told, no, no, no. This is an important exploring time for the child, and he must always be allowed to fondle and pick up objects and not be punished for it. Mrs. Trice said her conference colleagues will be especially concerned with the minority child. We will ask ourselves, will he be able to stand the pressures of the outside world once he gets to school and make progress in spite of society? Mrs. Trice, the daughter of migrant parents, is the mother of 2 children, Bradford and Valencia. She did her basic nursing in Georgia and became a registered nurse at the University of Miami. Before her present position at the clinic, she was assistant county nursing director for the Children and Youth Project for 2 years. In this project, Ms. Trice worked to get disadvantaged children as healthy as possible before they entered the first grade so that they could fulfill their learning potential. At the 46th Street Clinic, Mrs. Trice now supervises the activities of her staff, 34 professional nurses. These public health nurses make home visits, and the clinic provides pediatric, family planning, maternity, immunization care for a large section of Northwest Miami. The clinic cares for 500 persons each week. Mrs. Trice says the White House conference couldn't come at a better time. We feel a sense of urgency here. When I think of everything that is going on with the young people today, I'm convinced that we need to come up with something workable and good for all children. They're going to be the leaders of tomorrow. If we don't do something to help them now, I don't know what will happen to us. So let's continue. All right. So one of the most important positions that she held was as the president and chief executive officer of the Economic Opportunity Family Health Center Incorporated. So she was offered this position in 1980 and she took it. And just to give a little background on what was going on with the EOFHC before her, that first EOFHC building where they were treating people out of for 12 years was actually a trailer. They operated out of that for 12 years with the promise of getting a new building at some point. And hi, Javo, thank you for joining. And so in 1980, when she joined, they got a new building at Northwest 54th and 22nd Avenue. And this is where they were for the next 18 years until her retirement in 1998. So under her leadership, she led the community health center to become one of the largest systems in South Florida. She also turned the center, into the EOFHC, into one of the largest minority employers in the county. And under her tenure, the family health centers grew from 1 site to 12. And, it's really easy to say, she came in and then it was all great and she did a great job. And while that's all true, it doesn't really do service to her story, because it was not an easy time and her success was never really an assured thing. So the EOFHC was a nonprofit, and it basically stayed afloat with federal and state funding. And when she came into the organization, it had gone through 3 directors in 1 year, and that was prior to her arrival. So when the leadership of your organization when you're running through leaders that quickly, it's a pretty bad sign for the way the organization is. However, she came in and she put it all together. And as soon as she had put together this organization, she had to deal with federal budget cuts. So that was in 1982, and that was thanks to the Reagan administration. And here in the 80s, you had, basically Miami was at one of the heights of our immigration. Not only did you have Haitian immigrants, but you had Cuban immigrants, and you had everyone else who was coming to Miami at the time. So whether their financial situation was good or not, people were coming to these public health clinics. And in the midst of all that, she had to deal with federal budget cuts. So you could only imagine how difficult it was to be able to effectively serve everybody in a time where everyone needed to be served and there was no money for them. However, this didn't stop her. And, maybe I'm looking at it from a modern perspective, but she actually, in 1983, she got her center accredited, okay? So what that meant basically at the time was that accreditation for clinics was a very difficult thing to achieve. Not only was it very stringent, it was very expensive. And she fought to get the family health center accredited. So what this did basically was, aside from being an incredible achievement, it allowed the family health center to be competitive with private health systems. Basically, it made it so that the FHC would be favorably viewed by insurance companies so that they can compete for that private dollar. And, I can't go into Mrs. Trice's mind, but if she was reading the tea leaves and saw the federal budget cuts and saw how health was turning more towards private solutions than publicly funded ones, this move was an incredible business move. And, I'm going to keep talking about it, but to be an incredible nurse, to be an incredible administrator, and to be an incredible businesswoman, and to wear all those hats so well is a marker of an intelligent, incredible woman. And I really do have to tip my hat to her, because, and we're going to keep going through it. She did more, but that is pretty incredible. So, under her guidance, the agency started using non-traditional means to serve their patients. She established South Florida's first long-term residential program for cocaine-addicted women. She also set up a public health clinic in public schools for children and developing comprehensive community programs for HIV/AIDS. These programs were so innovative and effective that they actually became the model for other clinics nationwide. And so, let me read to you from a newspaper that was written in 1992. So, Liz, Miamian, urge AIDS funding. They come from divergent worlds. Actress Elizabeth Taylor surrounds herself with the glittering fantasy world of Hollywood and movie stars, while registered nurse Jessie Trice is swamped daily by the tragic realities of Miami families with AIDS. On Tuesday, the two urged Congress and President Bush, the first, to fully fund the Ryan White CARE Act, which provides millions of dollars to cities for AIDS treatments and patient care. Our cities have been allowed to disintegrate until a fiery burst of rage and fury exploded one warm night in Los Angeles, and now suddenly there is a rush to aid our urban areas, Taylor said. But nowhere in this new urban plan have I heard talk of fighting the ravages of AIDS. We cannot separate the blight of crime from the tragedy of poor health care. The Ryan White CARE Act of 1990 was passed to provide $270 million to cities with 2,000 or more AIDS cases. In 1992, Congress allocated $122 million for 18 cities. Jessie Trice, president of the Miami Economic Opportunity Family Health Center, which receives about $1 million in funding, said the full 275 million is badly needed. Our caseload currently contains over 550 HIV/AIDS patients, and we estimate that in our population, for every identified HIV positive patient and family, there are 2 who are positive and do not know it. So Trice told the Senate Committee on Labor and Human Resources, "I'm worried about how we can cope with a 3-fold increase in the number of families and patients in need of our services." So continue. So this is another story that shows what an incredible businesswoman that she was. So in 1994, she promoted the development and incorporation of something called the Health Choice Network. And this was done in response to the creation of something that was known, that we still know today, as an HMO. An HMO is a health maintenance organization. And so without getting into the nitty gritty of insurance, I'm just going to kind of boil this down to what, I guess, the brass tacks, right? So with the creation of the HMO, it basically created private networks of doctors who can now see Medicaid patients. When you are on Medicaid, you are basically, your clinic sites are being funded by the government. These are public dollars that are now being funneled into private organizations. So ergo, they're taking money away from public health facilities like the EOFHC that Jessie Trice was leading. So in response to this, she set up the Health Choice Network, which was a national incorporation of all these different publicly funded health centers, and basically made them into their own organization where people can see the doctors that they wanted wherever they were. And so this nationally recognized coalition of community health centers actually served more than 100,000 people here in Miami-Dade, Lee, and Henry counties. And she served as its chair until 1998. So this, again, is an incredible move. This shows kind of the foresight that she had in terms of being a businesswoman. And, it's very difficult because, everyone has, the debate in this country about healthcare has gone on for the past 100 years. And to see the kind of things that she's doing and dealing with, she's dealing with it not ideologically, but she's dealing with it as it is. And you have to give her a ton of credit for that, because of what she did, the FHC still stands today. And I would give her a lot of credit for that, especially in the circumstances of all the federal budget cuts that I'm sure have happened since 1992 or 1982. Sorry. So another program that Trice was instrumental in shaping and implementing, and this is another part of her holistic view on medicine, was the Healthy Body, Healthy Soul program. So this program actually involved training ministers so that they could educate their congregations on everything from asthma to diabetes. And the reason for this, Jessie Trice said, is because diseases that unequally affect the poor and minority communities can be prevented if detected early. And so if you train, for whether, and without getting into the macro system causes of it, I guess we'll say, whether people be afraid to go into the clinic because they don't think the doctors will listen to them, or be it for financial reasons, getting ministers involved and having them educate people on these health issues is a great thing, because even out of 100 people, if 1 or 2 people, or maybe it clicks and they see that they have to go to a clinic and they get helped, that's 2 diseases that are prevented. And that's an incredibly innovative thing that she did. And, again, to be a public health administrator and a businesswoman and to still be putting forth these innovative ideas that actually make a difference in the community is an incredible thing. So one last thing that she did was that in 1984, she organized something called the Black Connection. So this was a coalition of 15 Black organizations that were here in South Florida, and they came together because they felt, quote, that most of the problems in Black Miami stem from a lack of political, economical, and educational empowerment, end quote. So the groups who joined were the fraternities, the Alpha Phi Alpha, the Omega Psi Phi, the Phi Beta Sigma. Sororities who joined were the Alpha Kappa Alphas, the Delta Sigma Theta, the Eta Phi Betas, the Zeta Phi Betas, and then you had other organizations like the Black Caucus of Eastern Airlines, the Black Nurses Association, Operation Push, the Black Lawyers Association, and the FAMU Alumni Association. So, for all her works in her life, Jessie Trice was honored by multiple peoples and organizations. So, she was named to the National Advisory Committee on Infant Mortality by the U.S. Secretary Louis Sullivan in 1991. She was also named to the State Work Group on Healthcare by then Florida Governor Lawton Chiles. She was the recipient of the Miami Herald's Charles Whitehead Spirit of Excellence Award. She was also the recipient of the Women in Communications African American Research Library and Community Headliner Award. She was also recognized by her sorority, the AKAs, the Alpha Kappa Alphas. She was further honored by having a street dedicated to her at 22nd Avenue at Northwest 36 to 103rd Street, Miami. And Trice's last project was actually related to cancer prevention. She started the Jessie Trice Cancer Prevention Project, and it was dedicated so that healthcare providers would lobby for funds and put them towards lung cancer prevention in minority communities. Unfortunately, Jessie actually had lung cancer, and she succumbed to the disease on October 9th, 1999. So I have one more article that I want to read to you before I finish up today, and it starts like this. Long before this decade's debate on bringing healthcare to people without it, Jessie Trice was quietly working a one-woman revolution. I like to see results, says the president and chief executive officer of the Economic Opportunity Family Health Center, a private nonprofit center based in Liberty City. She has carved excellence out of everything she's done, says U.S. Representative Carrie Meek, noting programs for pregnant women, in-school checkups, and counseling, and providing jobs in the community. Her programs are an example to the whole country. After 19 years as a state public health nurse in Dade County, the last 5 as a nursing director, Trice joined the EOFHC in 1980. I had ideas of my own about working with poor and medically underserved people, she says. I wanted to do things. She scraped for funds and in 1987 opened a drug treatment program for pregnant women, one of the first in the country. Under her leadership, the EOFHC has grown to 12 Dade sites, where more than 60,000 patients are seen yearly, sustained primarily with federal and state grants. The buzzwords of today's healthcare debates are concrete achievement for Trice. Preventative care, education, and neighborhood clinics that give residents a say. It's foolish even to say that among Black professionals, she's an outstanding role model, because among any group of people, she is just superb, says EOFHC board member Al Parera, Chairman Emeritus of the First Equity Corporation of Florida. Trice speaks proudly of 2 children and 4 grandsons, but her age is a secret, lest anyone suggest retirement. Says Trice, there are a few other things I need to do. So, thank you for joining me today. This is a photo of Jessie Trice. An incredible woman, an incredible nurse, an incredible public health administrator. I mean, all around intelligent woman. And that basically covers her story today. So if you guys have any questions, I'll take it. If anything, remember that tomorrow we have our virtual field trips with the director, Timothy Barber. And tomorrow night we have the Lyric Live from the Living Room edition, hosted by Cello and DJH2. And on Saturday we have Storytime in Color with Camila Pritchett, so be sure to tune in for that. And just thank you guys for joining me again for another Legacies, Profiles, and Greatness. I appreciate you guys coming back each week. I enjoy doing this. So thank you guys for joining T Barber and Aw2Q Kitty. If there's no questions, no Lyric Live tomorrow. Okay. But still, we have the virtual field trip and the Storytime in Color. So be sure to tune in for that. And since I'm not getting any questions, I think I'm going to cut it. But thank you again for joining me. Stay safe out there, and I'll see you again next week.